So you said this. Some people use Ayurvedic oils.
Yes.
So we really know what exactly it is. So somebody is having a joint, they instead of taking some proper advice, they continue using Ayurvedic for a long time.
Correct.
So will it really curing it and prevent it at a later stage?
So Ayurvedic oils, when used as a topical application, it does not do any harm. But when it is taken inside, we actually don't know what it contains. Some contains heavy metals, some have got this steroids, some have got this methotrexate also. When it is taken daily, it may actually harmful without supervision. So Ayurvedic oils can be applied for a topical treatment, but it is not a substitute for the main treatment. It will just give a mild relief in the symptoms. It may act as a bridge till you take the proper medication. But the medical management can't be replaced by taking these topical medications.
So, for example, somebody is suffering from rheumatoid arthritis. That's one of the common psoriatic arthritis. How frequently recommended to visit a rheumatologist for a proper care? For example, for diabetic, we tell if it is well controlled, we tell at least 2 to 3 months once. If it is poorly controlled, we tell at least 1 month. So usually same thing. RA patients also have a long history. How often you recommend them to consult?
So if the patient, if we have recently diagnosed a patient with rheumatoid arthritis and still we are introducing drugs like one by one to see how he is tolerating, we'll ask the patient to come once in a couple of weeks, like after 2 weeks, 3 weeks, to just see that he's doing well on these medications. Once the patient is stabilized on the medications and he's doing well, the joint pains have come down and he is maintaining his lifestyle measures and medication which he's taking regularly, then we'll ask the patient to come once in 3 months, 3 or 4 months.
Okay. And now it's a trend now. Everyone get this a big list of tests online. Health, they go for a checkup, they'll order a big list of tests.
Correct.
So in this, usually common thing is we observed is in most of the people who test is one is the sugars, vitamin B12, vitamin D deficiency.
Yes.
How it impacts the joint health.
So vitamin D deficiency always, in so many studies, it has been shown that it is associated with autoimmune conditions. So vitamin D deficiency, not only autoimmune conditions, it also causes depression. So it is associated with so many other conditions, vitamin D deficiency, and it is vice versa. In autoimmune conditions also, we see vitamin D deficiency. Vitamin B12, because it is solely because of your diet, and some people have this pernicious anemia, like B12 with intrinsic factor, autoimmune, antibodies forming to the intrinsic factor. This intrinsic factor is needed for your proper absorption of B12. So when this is there, when chronic vitamin B12 deficiencies are there, you have to look for the cause, like why your vitamin B12 levels are low, or this B12 deficiency is associated with intrinsic factor.
So certainly vitamin D is linked to joint pains.
Yes.
Vitamin B12 not directly.
Yes.
Okay.
If you don't have signs and symptoms, usually I will not advise this test, rheumatoid factor and anti-CCP. But if you have a history, family history of all these things, there is only some 4 to 5% chance that kith and kin will get that.
So the parents are suffering from rheumatoid arthritis. So their son or daughter will ask them, so what is the chance of me getting arthritis, and if any preventive health checkups I can do to know that I am in an early stage to get this arthritis.
Correct. So if parents have got a history of rheumatoid arthritis, there is only a minor chance, like 4 to 5%, where their kith and kin will land up in rheumatoid arthritis. It is not always the same that if parents have got rheumatoid arthritis, kids also.
This is a very important point. You see, suppose both the parents are diabetic, there's a 25% chance that the kids can get a diabetes. Both the parents, but in this case only 5 to 6%.
Yes.
So do not worry that all the parents are having ARIA, I should not get
yes. And not only that, if the parents have got rheumatoid arthritis, kids will not always get rheumatoid arthritis. It can be any other autoimmune condition like Sjogren's, systemic sclerosis.
And in terms of general joint health, so what are the blood tests you can recommend to get at least once a year when people go for a normal health checkup? What are the specific tests you can recommend from your side?
So I would advise vitamin D levels, calcium levels, magnesium levels, and B12 levels, as you told.
Okay.
To see where.
So vitamin B12,
vitamin D,
calcium, and magnesium levels.
Yes.
You can also include the CRP.
And if it is an older patient, you can get a DEXA scan to see if they have osteoporosis.
Okay. So DEXA, you can tell a little more about DEXA scan.
DEXA scan is bone mineral. It is a test where it detects bone mineral density, the density of the bones. So usually in older people, like above 55 years and 60 years of age, bone density, we lose bone density. Yearly we lose around some 10% of bone density is lost, and especially after menopause in females. So to detect the bone mineral density loss which is happening, we do this test called bone mineral density test or DEXA scan, where it will show the density of your bones in some numbers, and it will tell the future fracture risk. So the bone mineral density.
The more use of DEXA scan is, you can accurately know the fat percentage.
Yeah,
fracture. Visceral fat percentage. Usually, when you go to the gyms and all, there is a mission and all. They will tell you have so much of visceral percentage, but DEXA scan will give you very accurate picture of your visceral fat, how much fat percentage you have. Along with that, it will give the bone density also. Okay. And the last question: any impactful case you have seen where people have neglected for months or years and finally end up in a serious complication?
So many I have seen. To start with, recently I saw a young male who had this back pain. So he is a hard worker like laborer types. So he thought his back pain is because of some disc slip over. So he has been showing to so many physicians, so many people in his place, but everyone were not actually so keen on doing MRI of his back. So this was going on for past 4 or 5 years, where it was being treated like a mechanical back pain only. So once we did MRI, it was actually showing the inflammation, which is called spondyloarthritis. Actually, his bones are fused. So the fusion, once the bone fusion happens, so it is like a stage where we can't take it back. We can't bring the bone back to its normal shape again. So we diagnosed him as ankylosing spondylitis, also known as spondyloarthritis axial predominant. And then we started him on medication where to some extent his movements have been relieved. But the stiffness which he has got, like he's unable to move back, he's unable to bend forward, that could not be recovered to a full extent. Had he come early in the, when he had back pain,
okay,
we could have.
So early intervention is always safer. Yes. Okay. So the next video specifically for the general practitioners that when we should consider referring to a rheumatologist. So this video is really needed for the public. Next video will discuss briefly in 5 minutes about when should a GPs and general practitioners should refer to a rheumatologist. Thank you.